I'm going to go ahead and call our subcommittee meeting to order, and we'll begin. You've all got your tracking sheets, and we've been working on this budget for quite some time. What I'm going to do today is discuss just the differences or the changes that are in there so that we can go ahead and pass this along to the full committee for their consideration. If you will begin, look down on 17.6, down at the 17.6.2. This is some later information that we got from OPB and all, and what they're going to do there, that the total funds number is going to be increased some, and the reason for that is that we've still got the 14.4, but they're going to be able to use some other funds so that they can draw down the maximum amount on that dish money with that. So the only difference is just going to be the total there, so we can draw down all the match money that's available to us on there. And then if you'll flip over to 17.8, that's your Medicaid low income. Call your attention to two items, 17.8.5 and then also 17.8.10. And if you will look at the 8.5, the number has increased there. This is the where we have transferred that money out. We increased that, but then look down on 8.10, and you'll see that that 4.1 million, that's put in as a separate line item. This is pertaining to the program that we had endorsed last year to help prevent low birth weight babies. That's at 90-10 federal match. This is to help prevent low birth weight, which are, when those children come along, they're very expensive, and they felt like this was a good program, and this just signals the intent of the legislature that that be put in there by putting that in as a separate line item there. And then if you will flip over to 17.18, that's the drugs and narcotics. There's a $50,000 ad right there. This is, they're authorized for some 15 agents. They only have about 9.5 FTEs, and this will help them to ensure that the safety in the manufactured and the compounded drugs as well as help combat drug diversion and with the pain clinics and that sort of thing. So we're asking you to approve that. And then our last item, let's see here, over under public health, 37.3.1. Just want to point this out to you and bring this. The governor had recommended that 1.25 million. This was to allow public health to begin the process of integrating the district and county health department's clinical information system, and this would allow the health departments to keep their records together and also enhance their capacity to do billing, like to Medicaid and other insurance, where they would be able to recoup some funds. So we're asking that you go along with that as well. And that is the changes that we have on our sheet. Do we have any questions or comments from the committee members? If not, we'll entertain a motion to do pass. Have a motion to pass and a second. Any discussion? All those in favor say aye. Aye. Then we'll pass that along to the full committee as do pass. Thank you very much.